Welcome to ZMed Talks, a channel where we bring you insightful conversations with professionals all across the medical field. Whether you're a student, another medical practitioner, or just someone interested in healthcare, this is the right place for you to be in. If you're interested in our content, don't forget to go down and hit the subscribe button and turn on the notification bell for all notifications. Let's get right into today's video. Okay, so thank you once again for being part of the interview. Yes, you can start by maybe telling us a bit about yourself and a brief background.
Okay, it's my pleasure and thank you so much for having me. So my name is Sompra Mansa. I'm a pediatric anesthesiologist. I'm currently working in clinical practice and I also serve as president of the Society of Anesthetists of Zambia.
That's president of?
The Society of Anesthetists of Zambia.
Okay, so you can start by talking a little about that.
Okay, so SAS, the society, is essentially a special interest group which represents physician anesthetists like myself, as well as all anesthetic providers in Zambia. So essentially we look at things like standard of care provision. We also provide continuous medical education for anesthetic providers. We also provide support for people who are in postgraduate training for anesthesia, as well as liaising with other anesthetists in the region and across the world.
Oh, so you mentioned people who are in postgraduate training. So let's say someone finishes, graduates with a bachelor's degree in MBCHB, then how can you guys be involved in that?
So essentially there are three streams of postgraduate training that somebody can enroll in. So in Zambia we have of course the specialist training program, or STP, in anesthesia through Zambia College of Medicine and Surgery. We also have the MED program, the Master of Medicine program with the University of Zambia. And we also have something that is known as a fellowship with the College of Anesthetists of East, Central and Southern Africa.
Right. So we'll get back to the specialty, but for now you can tell us about your journey in becoming a doctor. Yes, what inspired you to choose the pathway as well?
So I think I've always, from the time I can recall, I've always wanted to become a doctor. I didn't really know what kind of doctor. When I was younger, we just knew that there were doctors. We didn't know that there were surgeons, anesthetists, physicians. But I think that what really cemented my path to becoming a doctor was the fascination that I had with biology. And then also, as of course my learning progressed, understanding the interplay between chemistry, physics, and biology, and how all of that works together in the human body to have this functional, living, breathing being. It completely fascinated me, and the more I got into it, the more I wanted to know more, and the more excited I got about it. So it sort of guided me along this path to where I eventually found myself in medical school.
Okay, yeah, it seems like a lot of people actually who have an interest in biology and different science-based courses or subjects end up doing the same program. Yeah. So what are the most rewarding and challenging aspects of your work?
So I think the most rewarding aspects of my work, being that I'm an anesthetist or an anesthesiologist, we basically work with a lot of pharmacology.
Okay.
We use that to manipulate physiology to produce a certain outcome,
Okay.
right? If it's an outcome that allows for surgery to take place, or if it's an outcome that leads to successful resuscitation, that's what we do. So a lot of the positive outcomes that I would say is when I'm trying a new anesthetic technique. It can be a regional anesthesia technique, or I can be trying total intravenous anesthesia, and I see it work and it works well for the patient. For me, that's really very, very rewarding. Of course, the challenges come with incredibly complex patients, patients who have very unique physiological characteristics, patients who are very sick, and navigating them through the perioperative process can be very, very challenging, can be very, very stressful.
So does that include people who maybe have an allergy to like anesthesia or something? Because I have seen in some instances, even in like series or stuff, where you find that the patient comes and then they have a reaction to the anesthesia during surgery.
Yeah, I mean, it encompasses everything, anything and everything that you can imagine. You know, they say that fiction is based a little bit on truth. So, a lot of the situations may not happen as they do on TV, of course, because of dramatic effect.
Right.
But we do sometimes see some of those situations in the operating room, and we have to be able to navigate our way through them.
Right. Okay. So could you roughly describe your typical day at work and how does it differ from day to day?
So essentially, with the place I'm working now, different days have different specialities.
Okay.
And then Mondays and Fridays are typically for any patients that weren't managed during the week or any emergencies that come in. But that being said, my day usually starts at about 7:30,
Okay.
and then I'm in theater until about 16 hours usually, depending on the caseload. Sometimes I might go over, or sometimes I might end a little bit earlier. So I see variety of patients, pregnant women, pediatric patients, orthopedic patients. It just depends on the day.
Okay. So the next few questions will be about your specialty.
Mhm.
Yeah. So you can tell us a bit more about your specialty and what's involved there, and yeah, everything to do with anesthesiology.
So, like I said, the simplest description of anesthesia really is the practice of manipulating physiology with certain drugs to cause a desired outcome, right? So we are able in this day and age to use different anesthetic techniques where we might have a general anesthetic, spinal anesthesia, a regional anesthesia where you only block a certain part of the limb, and different anesthetic techniques. We also use those as well to incorporate in pain management strategies for our patients. We're trying to look more into using non-opioid pain management for our patients. So it's a very exciting sort of time to be alive and practicing anesthesia. So that's essentially what it is. We are perioperative specialists, really. So we're just there for that 24 hours before, for the duration of surgery, and maybe for 24 hours afterwards, ensuring the patient gets through that period safely and pain-free.
Okay. And then what about in issues of emergencies? Because you said that you've got a specific work schedule, though you can go above that from time to time. But what about if, let's say, for example, the patient that you're dealing with ends up having a certain reaction at, let's say, midnight or something? Are you still maybe contacted for that issue?
Absolutely. So in Zambia, anesthesiologists who are trained at the University of Zambia have what we call a dual qualification. So it's anesthesia and critical care. So not only do we deal with any emergencies that involve theater, but we also deal with any intensive care or life-threatening emergencies out of theater, not just in the post-op patients. It can be in any sort of patient that needs a higher level of care.
Okay. So maybe for those who might be interested in taking up that specialty, maybe you can just briefly go through the pathway that's taken, from your undergraduate study up to the point that you reach.
So what I would definitely advise for anybody who wants to look into going into anesthesia is, first of all, at undergraduate level, spend some time in theater, spend some time with the anesthetists when you're doing your theater rotations. That's where I got my first taste of anesthesia. If you're engaged and involved, a lot of times the consultants will actually let you do 1 or 2 procedures. They might teach you things about intubation, spinals, and things like that. That's always a great place to get your foundation in as well. And then from there, of course, once you've done internship, we go into postgraduate training as well, using one of the 3 available routes that we have here in Zambia.
Okay, is residencies involved there?
Yes, so all 3 of those have some sort of residency program attached to them, and they're all equally about 4 years long.
Okay. And then from there, any subspecialty?
So you can subspecialize in anesthesia. I subspecialized in pediatric anesthesia.
Okay.
So I did a 1-year fellowship after finishing my residency program and working for some time. We also have cardiac anesthetists in the country. We have obstetric anesthetists, as well as those who are called regional specialists.
Okay. So, what advice would you give to someone considering a career in medicine today, in general?
I think that when you look at a field like medicine, there are a number of features, a number of qualities and characteristics that you need to have. The first one being that you have to strive for excellence. in everything that you do. Patient care, studying, applying yourself, you have to strive for excellence. Not necessarily perfection, but you need to do the best that you can. The second thing that you need to have is compassion. Compassion for your patients, compassion for the people that you're working with, as well, and sometimes compassion for yourself, because medicine can be quite tough. And finally, you need to be somebody who recognizes that you will never know everything. There's no end point to learning. And if you have those three attributes, I believe that you will go far and you will go well along your medical journey.
Okay, so knowing that this is medicine and you're dealing with patients that are in critical conditions, life and death, there might be instances where people might die in the operation table and things like that. So how do you balance the emotional demands of your job with your personal life?
I think that it's very important to surround yourself with people who can act as soundboards. Okay, so people who you can go and talk to and debrief about some of the challenges that you are facing, if you lose a patient or if you have a particularly difficult case and things like that. I think that's very important. But also understanding how you cope with certain things and adopting healthy coping mechanisms. Everybody needs that time to disconnect, if it's read a book, if it's go for a run. Everybody needs to ensure that they are committed to having that time off.
Yeah, because they do tell us in school that you need to have that relationship with other people who are doing the same program. Because you find that people coming from pre-medicine tend to have that thing of like wanting to study by themselves, or like since they're used to talking and stuff like that. But usually lecturers will tell us to try and work together in order to cover more information and stuff. Because since for example, preclinical, you're doing a lot of theory. So like for you to like get all that theory, you need to have people with you. And then also doing clinicals with rotations and things like that. Even just working together with nurses. Yeah. So and then you said that you need to have a coping mechanism for some of that. So do you have any hobbies or interests outside of medicine that help you unwind?
Yeah, absolutely. So I'm part of a book club. So myself and a group of ladies, I think from diverse professional backgrounds, we meet every 2 weeks to discuss books that we're reading and make sure we try and read about one book a month. I also do a bit of gardening and things like that. So I do try and find very non-medical things and interests to keep myself busy and occupied when I'm not in hospital.
Okay. So I've just got one more question for you now. What do you think is the most important lesson you've learned in your career so far? Any life lessons, something that has stood out to you and you're going to keep for a very long time?
Of course, there have been several life lessons that I've learned over the course of my career. But I think that the one that I think has had the most profound impact on me is the openness and the willingness to learn. I've been very fortunate to get to meet anesthesiologists who've been practicing for longer than I've been alive, and how they approach new information, even if it's coming from me, somebody who's much younger than them. There's always that eagerness to learn and learn from anyone and everyone. There's never that sort of pride, like I've been in this for so long, I know everything, you can't teach me anything. And it really filters through with the way they interact with people and how people want to be around them, because they're very open, sort of easy to approach people. So that's something that I really try and emulate in my day-to-day practice, when I'm meeting new people, when I'm in different sort of situations.
Right. So any extra words for the viewers, something just to keep
I think anesthesia is one of those things that is really a fringe sort of science. People don't really know much about anesthetists, because it's not every day that you have surgery, right? But I think that for those who are watching, especially who are in medical school, have a chat with the anesthetists or with the surgeons. Theater is such an exciting place to be. It's really phenomenal, and it allows you to really think through and plan through and come up with novel ideas and solutions, and it's a really great place to be.
No, it sounds like a really interesting path to take. I might also be considering specializing in anesthesia.
That would be great.
Yeah, though for me, I actually want to go through
cardiothoracic.
Okay.
Yeah, if all goes well, they don't get tired looking at the time. But otherwise, everything to do with surgery, I have an interest.
That's great.
Otherwise, thank you for being a part of this interview once more, and please have a nice day.
Thank you so much. It was a pleasure.